Welcome to the Aesthetics Unfiltered Podcast. We are Mishell Jones and Melanie Torres, two leading medical aesthetic nurse practitioners and great friends based in California. We uncover the inner workings of the booming aesthetics industry from both the patients as well as the providers' perspectives.
Join us for the authentic conversations about current and trending treatments, best practices, and the real issues people face with modern beauty standards. Any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
Hey guys, welcome. We are back and I have another guest speaker for you. It has been kind of a crazy time. Life has been lifing. And today everything is laser focused.
I love that.
So we're going to talk all things laser. And I have a guest speaker who is also Mishell. And we've worked together in the industry. We met a long time ago. We'll tell you our journey. And she is a laser expert. So that's why I have her on. And since lasers are the thing right now, we're going to go all into the details of lasers and everything you need to know. How's life?
Life, as you said, is lifing.
Yes.
It's been really crazy. But I feel like right now, things are on a mostly positive note.
Good.
Yeah.
All right.
I'm in a really good place. I work for a company that I really love, which is Sciton.
Yeah. Sciton's one of the biggest laser companies in our aesthetic world.
Names like Moxi, Halo, BBL are products that I work with. And I'm really happy to work for a company like this, but also just really happy to reconnect with you because talking about my story, Mishell actually trained me on lasers for the very first time. How long ago is that now? That's what I was trying to think in my head. Like, how many years has it been?
Well, I've been in aesthetics for 13 years. I think I moved up here maybe like 2 years into so probably maybe 11 years ago.
Yeah, I was thinking, I think it was
10,
like
11.
2016 or 2015 that we worked together for the first time.
Yeah.
Which is crazy.
So crazy. It's a small world in aesthetics once you've been around for a while. So Mishell is also a registered nurse. And we worked together, like 10 years ago.
10 years ago.
And we were mainly doing laser hair removal and tattoo removal and little sprinkles of filler and Botox.
Exactly. Literally little sprinkles of, mostly it was lasers. That's why it's.
And I would cry in the bathroom and I had bright pink lipstick every day.
Yes, you did.
I was maybe a little nicer back then.
I think you're pretty consistent. If nothing else, you're consistent.
Oh, wow. So that's good.
Some things never change. Let's put it that way.
Thank you.
You're always very much yourself.
Aww.
If anything, what I said last time when we met is it almost feels like you feel more comfortable being you now.
Yeah. Thank God. That comes with being 41.
With years, right? So it's like,
Well, we have another guest star right here. This is Zippy. And if you're watching on YouTube, he has his leg up and he's saying hello.
He's so
cute. He is an exotic short hair who needs to go on a diet. But he's a lover and he's also a Gemini. I really want to talk about Mishell has a unique journey within her nursing career. And I think it's really inspirational just for people, for injectors within aesthetics to kind of navigate different experiences within aesthetics, and also just people getting into nursing in general that can kind of be inspired of different paths and avenues that you can go down. And it just doesn't have to be hospital or just even in a clinic with aesthetics. There's a lot of cool things that you can do. And we were both, I'm still a trainer and I also work in the clinic, but Mishell was a very successful trainer for lasers and now has a new role. So tell us about just your laser journey and your nursing journey.
Yeah. So I actually, just like all good Filipino children, went to nursing school. I actually went to nursing school in the Philippines.
Oh, I didn't know that.
Yeah.
Cool.
So I actually graduated back in 2010 in the Philippines, then moved here because I wanted to pursue, again, just like any good Filipino child, you pursue a career in the US. And so I remember I challenged the NCLEX, I passed, but then I had so much dread. I didn't want to be a bedside nurse.
Yeah, it's hard.
I had seen a lot of things that I think maybe just caused burnout prematurely when I was in the Philippines, because it is a third world country and things are really rough out there healthcare wise. And so when I came here, I just didn't think, even though I wanted to be, even if I wanted to make my parents proud and utilize the education that I had in nursing school in the Philippines, I was already feeling a little burnt out, and like I knew I wasn't meant to be a bedside nurse. And so,
and you were burnt out before you even started.
Yeah, I just remember I tried to get into, when I was in the Philippines, I thought it was going to be labor and delivery.
Oh, okay. Nice.
Is what I was getting into, but then I could tell stories for days, but that's not what this is about.
Could be.
Yeah, and
we're just entertaining you all.
Yeah. And so when I moved here, I remember that I took a job with a podiatrist.
Oh, I remember that. Yeah.
Did I tell you the story? So I took a job with a podiatrist, and I was just his front desk staff.
I was asking you like toenail fungus questions.
Yes, it's so gross, but basically what happened is I had taken a front desk job with a podiatrist, and he asked me why I was a front desk staff when I actually have my nursing license.
Interesting. Yeah.
And I told him that I didn't want to be a bedside nurse, but I'm not sure what I want to do. And he introduced me to my very first laser, which was a Cutera Genesis Plus for toenail fungus.
Oh, wow.
And he said, there's so many different things you could do as a nurse. And I noticed that you really like beauty, because I was a makeup artist on the side at the time.
That's right. Yeah.
And he was very observant, and he saw that. And so he taught me how to use my first laser and said, if you learn how to use this laser, this could turn into an entire career for you, where you then get into aesthetics. And that's something I didn't even know was an option at the time. And so for 3 years, I built his onychomycosis program. Onychomycosis is toenail fungus. It's absolutely disgusting. But I worked with him for 3 years on that protocol. And one day he looked me in the eyes and said, either you quit or I fire you, because you're not meant to be doing this forever.
Really?
Yeah.
I just got chills.
Isn't that amazing?
So he was really pivotal in your career.
Yes. And so I still keep in touch with him. We talk every Christmas time. And I'm so grateful for him, because it was that conversation that actually led me to Mishell, and she actually introduced me to proper aesthetics, because all I had experience with at the time was toenail fungus and warts. Yeah. Absolutely disgusting.
That's funny, because part of my nurse practitioner track is I did like 4 to 6 months just cutting like veterans' toenails with fungus. So I'm an expert in that too.
Yeah.
And I've done it. I'm there. Nothing grosses me out anymore. Yeah. I'm just like, once you can do that, and it's kind of fun.
You could literally do anything.
Yeah.
It's weird, because there's something satisfying about it, but I guess
there is. Yeah.
I guess to do what we do, you have to find satisfaction in the grossest things.
Yeah. Yeah.
And that's just kind of how it is. But that said, I don't ever want to do it again.
No, me either. I've done that.
Been there, done that.
Yeah.
We're all good to go. But yeah, so we worked with each other for a couple years, Yeah. But all of the basic foundational knowledge of lasers that I had is from you.
Really?
Yeah.
Which I felt like I wasn't even that. I'm a passionate person. I know the basics well, but now Mishell is my mentor on lasers.
Aww.
So the role is reversed.
It's interesting, because then I came back to do a training recently.
Yeah, and that's how I reconnected with her. So you just recently trained me on the Moxi laser, which the Moxi is pretty basic compared to, I would say, halo laser that we've done in the past. So it's pretty much a breeze, and it's similar to Clear and Brilliant. Tell us about what you've done at your current job. So you're at Saiton, and what was your job before? You were doing a lot of trainings or traveling?
So what had happened is I actually ended up connecting with a company called Cutera.
Oh, yeah.
And Cutera got wind that basically I had experience training, also that I had experience with the Cutera Genesis Plus.
Oh, so that was helpful. Yeah,
and they really needed somebody to do their clinical trials, somebody who had a lot of experience using lasers, but definitely also had experience using their laser, their product. And so I ended up working for Cutera doing clinical trials.
Nice.
That spun off into, because I get really nerdy about lasers, everything that I was learning in the clinical trials, I ended up teaching the Cutera trainers.
Wow.
So they would come in, I think quarterly or twice a year at least, and they would come into my lab and ask what all the new things that were going on were. And I ended up building what we call the Train the Trainer program.
Oh, you did? I didn't know that. Wow.
I did this with the basically head of clinical. It was just an opportunity for all of the clinical staff of Cutera to sort of geek out together and learn about what's new. New protocols, new ways of doing things. And that spun off into me becoming a trainer.
Wow.
Yeah, which I think that's been the thing I've enjoyed doing the most in my career is teaching, learning, and then teaching everybody what I know. And so I did that with Cutera, did that with miraDry, and then for the last 3.5 years, it's been Sciton.
So all the big like laser companies in our industry, and miraDry is different though. That's like a whole different beast.
Oh yeah. So
give us a rundown of what miraDry is, and do you think people are still? I don't offer that in my clinic, but do you think it's still a big hit or certain population for it?
I think in the industry you find creative ways to use certain types of energy, right?
Okay.
Because it's very cyclical, I guess we'll say. There's only so many different types of energies we can use for the purposes that we do, and you just try to find new ways to utilize them. So what I loved about miraDry is they took microwave energy.
That's so cool.
Literally what we use to heat up our food. And they figured out a way to make it so that you could actually treat chronic sweating. So cool. Hyperhidrosis permanently.
Yeah.
And so one reason I wanted to work for that company is because you try to find the most innovative products. Yeah. And to me, for that moment, that was very innovative. Yeah. To this day, I still don't think there are any other competitors for miraDry.
Do you think Morpheus, because there's like an off-label thing where you could potentially, I haven't tried that yet for hyperhidrosis.
For hyperhidrosis, generally the energies that are very common are RF. Yeah. Well, actually, it's always going to be RF. And then, of course, like you can use tox as well.
Botox,
but it's more of like a temporary, like you have to keep keeping up with it, as you know. But the thing about miraDry is since microwave energy isn't top-down heating, radio frequency is top-down heating.
Right.
It's hard for you to actually get to the target temperature required to kill sweat glands before the patient is just in too much pain. Yeah. Yeah. So RF can be a little bit trickier because you need to get past the hump of patients being in too much discomfort.
Yeah, I heard it's painful.
Yeah. Where with microwave energy, it isn't top-down heating. It's heating at the depth that you want.
That is so crazy, microwave.
Yeah, microwave. Like you're literally nuking sweat glands.
So we are a little off topic, but we're just, Mishell's a wealth of information. All right. So now you're at a really big laser company. What are the main lasers that people are doing? I know we have Moxi, Halo. Those are and BBL, right? So those are the three biggest lasers, I think, in our industry still.
I think at the moment. So it's, again, trying to find creative ways to use energies that already exist and have existed for a long time. So with Sciton, BBL is probably the bread and butter. Yeah. It's a pulse light treatment, which is a lot like IPL. Yeah. But built in a much more sophisticated way that accommodates more skin types and more indications. And so that's probably one of the most popular
BBL,
things right now.
Broadband light. What do you think the difference, and I always get this question, between IPL and BBL? They're pretty much the same? Slightly different?
Technically, they are the same thing. Gosh, I probably shouldn't say that, but they are pulse light treatments. The key difference between BBL and IPL is BBL is called broadband light since it does use a wider range of wavelengths than IPL does. Easy. Yeah. So it can be a little more thorough in that it can treat more superficially. It could go deeper than an IPL could. And then there are other like little technology differences between the two, but at the end of the day, they're pulse light treatments.
Okay. Yeah. So just competitors.
Yeah, exactly. And like who makes it better, right? Yeah. Is always the question. Yeah. But yeah, it's like nowadays, pulse light treatments, I think Sciton is making it so that pulse light treatments continue to be very relevant because honestly, IPL, I was ready to kind of
Really?
We know how dangerous IPL
can be. Dangerous on like more olive skin tones. You could burn someone pretty easily. Yeah. And even though it's such an easy treatment, it can be kind of scary, right?
Yeah. I mean, they say that pulse light treatments have the highest litigation rate.
Oh, yeah. I believe it.
Yeah. And so
Mm-hmm.
it has been really important to find ways to make it safer.
Mm-hmm.
And I think BBL kind of accomplishes that in a big way.
Yeah.
But then, so it's that. And then a lot of resurfacing is now becoming popular.
Yeah.
Because
Tell us your top resurfacing.
Resurfacing, for me, I really prefer a 1927 wavelength or a 2940 erbium wavelength. If we're doing 1927, that's
different.
a lot like Fraxel.
That's Moxi and Fraxel.
Clear and Brilliant. That's
Right.
Moxi.
Easy.
There's a bunch of 1927s, and I think every practice kind of needs one.
I've been so happy since we got our Moxi. Thank you.
Yeah. I'm glad. I think they're so good because they can treat all skin types safely.
Mm-hmm.
It can address like pigmentation and texture. So it's just like a good all-rounder with a very low risk of adverse reaction.
I think so. It's nice. It's good. Gentle laser.
Yeah. And we're coming into a time where like the younger generation now wants treatments, and they don't want anything that's too aggressive with too much.
It's just funny when patients come in, they're like, I want a laser. And you're like, oh boy, well, there's lots of different lasers. Like, what are we? And every practice has a different laser or different lasers. And some lasers are appropriate and some lasers are not. And so it's funny how the general public just envelopes everything as a laser. And it's like, how do I answer that question?
Yep. And it's also crazy, if you probably can relate to this, certain brand names.
Yeah.
They're just certain brand names that have become very popular because that branding is so powerful.
Kind of like Botox is an umbrella for all the neuromodulators.
Exactly.
Fraxel is an umbrella for like a lot of the different
Everyone
lasers.
knows Morpheus 8.
Morpheus.
Because that's going to be sort of like the king of RF microneedling in so many ways. So it's like, and then you have your halo when somebody thinks about resurfacing or anti-aging treatments. Halo is like one of the first things people think of. So yeah, branding is that's something that I really want to learn how to conquer.
I like how you said that we're not really reinventing the wheel, just things are being packaged differently and being more efficient. And it's like you can't just make up a wavelength, like all of the
That's true. Although if you find a way to do
Can you?
No. There's definitely certain wavelengths that are used for specific things, and it's about creating a technology that's new and exciting and addresses different problems in a better, safer way.
Exactly.
Yeah.
That's
so the more the industry grows, the more of that we see.
Yeah. What would you think like the main difference like between Halo and Moxi is?
Depth, honestly.
Depth, right?
Yeah. So you have your Moxi, which can treat the more surface area of the skin.
Yeah.
So within like the first 1 to 200 microns of the skin. And so that's pretty much where a lot of like your stubborn pigmentation sits. So your Moxi is going to be a lot better for treating that stubborn pigmentation and a little bit of surface texture, like very mild texture. Then once you get to Halo, that's more, anything after 200. So it's 200 to 700 microns it's treating.
So how much depth is that? It's like, I know 100 microns is
it takes 1,000 microns to make 1 millimeter.
1,000 microns. Okay, 1 millimeter. So it's very superficial.
Very superficial.
So what's the deepest that Halo can go? I always forget. 1 millimeter, right?
Barely 700 microns.
Wow. Okay.
But we find a lot of resurfacing experts actually like more superficial depths with resurfacing anyway. Usually for treating like overall rejuvenation or revitalization, those protocols are usually about 300 microns or so.
Oh, really superficial. Yeah.
Yeah.
So probably not the best for acne scarring because that needs to be deeper, right?
That has to be about 1 millimeter deep generally.
Yeah. So I get this question a lot. What's the difference between Morpheus, Halo, and Moxi? So you already went through Halo and Halo and Moxi.
Yeah.
So how do I throw Morpheus into that mix? Because everyone's so confused. Or RF needling. Like, how does that compare to a laser?
So the thing about lasers is they generally have different target chromophores. So they see certain colors in the skin, let's say. Hemoglobin, melanin, water are targeted by lasers. Whereas radiofrequency, it's just heat. That is literally what it is. It's just heat. And so we've been trying for so many years to figure out the best way to utilize this type of energy. It's been used for skin tightening.
Yeah.
It's been used for fat reduction.
Yep.
But the issue with it is that it's quite painful.
Yeah.
And so in modern times, what we've tried to do is find a way to drive it deeper into the skin.
Yeah.
Without overheating just the very surface.
So they can recover fast.
Exactly. And so needles are what we're using.
Oh, yeah.
Now.
That's what we're using. Yeah.
That's how we're driving.
Because it's different than thermage. Because back in the day, thermage was like the main radio frequency, but it didn't puncture the skin. It just goes under the skin and makes like heat.
Exactly.
But now we have Morpheus that is like needling plus heat plus the RF.
Yeah, essentially those needles are driving the heat deeper into the skin.
Oh, so it's able to go deeper.
It's able to go deeper, and you have the added benefit of that injury. That
from the needle injury.
The needles.
Yeah, helps the texture.
Exactly, helps the texture.
Yeah. Okay. Yeah. I mean, I feel like it is painful, but it's. I've never had to like stop a treatment. I'm probably the biggest wimp, and I get through it. It's still hard for me. I'm very sensitive, even though I do everything. But yeah, I feel like that's probably better for like people that maybe have a fuller face and want some contracting to the skin, a little bit of like fat reduction with tightening. It's probably better for people who have like acne scarring, maybe people where pigment's not an issue.
Yeah.
I have this whole thing, and I know this is not laser. We're talking about RF needling, but it does get thrown into the mix because everyone gets so confused. You know, there's so much education. I was going to say the word hate. That just totally came out. It's the total opposite. I was trying to have a nice word. There's a lot of hate online, especially from plastic surgeons about Morpheus and fat reduction.
Mm-hmm.
And I can give you my spiel on it because I do a lot of Morpheus. And I can get your spiel. You know, I think it has to do with the depth, right? If you're at the right depth, we're not going to melt fat, but if you're at the wrong depth, then you are. And so it all comes down to how thick that person's skin is, what you're trying to achieve. You know, sometimes I'll only do the 0.5 millimeter depth with this, which is called like resurface on Morpheus, to like, you know, help with the texture if I'm worried. I think the neck is where people get in trouble because the neck skin is so thin. If you're doing even a 2 millimeter, it's way too much on the lower neck unless it's like a really fatty neck. Sorry.
Yeah.
Do you agree with that?
I completely agree with you.
Okay.
And that kind of leads into, for me, a lot of the success or lack of success with lasers and different energy-based devices is, if I'm completely candid, a lack of education or proper education on how to use these different energies. And it's almost like for the longest time, this information has been gatekept.
I think so.
Don't you think? It's been kind of hard to get knowledge or obtain more education on how to use, because I think all different energies have a place in the industry.
Yeah, I agree.
And I think there's a proper way to use each. And to your point, with something like RF microneedling, depth matters so much. I think more is what we always thought for the longest time.
But it's not. Yeah.
Just because Morpheus can go that deep, we will always want to go that deep, right? I think it depends on what your goals are. If it's not fat reduction, then don't be going.
Don't be going 3 to 4 millimeters.
Exactly, right?
No, that's helpful. I mean, I think the thing that's hard out there is, you know, a lot of everything online is just clickbait. And I try to be more educational online than just like clickbait. And a lot of injectors, and they just want you to click on their post and you only get half of the information. And then there's a whole bunch of crazy comments that are arguing because that's what gets their feed more views.
Exactly.
And it's kind of toxic.
Exactly.
So we need to, you know, it's good to have just like conversations and, you know, reach out to the right people that have more answers, or, you know, that's hopefully your injector finds someone who can answer all your questions. But yeah, so there's so many questions on lasers. And I think even for us providers, like it's hard for us to answer all these questions because it's like now everything in aesthetics is like laser physics.
Yes.
And it's like, we are really like actually having to use a little bit more of our brain power to understand all these lasers.
Exactly.
And lasers can be really fun, but they can also be really dangerous if you're not trained properly.
I think we take for granted how complicated it can be.
Yeah.
And although, so the trend right now in the industry is let's make these devices that even basically, I want to say there's a more polite way to say the lowest common denominator, but like,
no, I love it. Just dumb them down for us. You can't mess them up.
To cater to even somebody who just graduated saturated.
Well,
basically.
I mean, the Moxi laser is setting 1, 2, 3.
Exactly.
And I was like,
that's the trend right now.
okay.
Let's find the
I kind of appreciate it though.
I do too. But then you realize that you get to a point where, yes, I can get started using lasers knowing I can pick level 1, 2, 3. But when I want to become proficient, then you need to start really understanding the physics behind everything. And that's where I hope we end up with more education over the years versus less.
Yeah, and I feel like there's more conferences just for lasers now, which is like, I didn't see that in the past. Because we need that. Mm-hmm. Why do you think lasers are so on trend right now? Why do you think it's all of a sudden, it's like blowing up this last year?
I think it's the population or the demographic that currently wants these treatments. They're people who were a little bit more educated on preventative maintenance earlier on. Their parents, they learned from their parents to wear sunscreen, learn from our mistakes, right? So they've been wearing sunscreen. They've been doing their skincare from an earlier age. And
so preventative, you think?
Preventative. And so now I don't think that they want like these big one and done treatments, procedures. They want, more preventative maintenance, more continuing to take care of their skin over time with these gentle techniques. And so lasers are kind of a good foray into that.
Yeah. Okay. Yeah. I think it's like more of a preventative, and skincare is really on trend. And I think, unfortunately, everyone got scared online with the overfilled look, and people realized if their skin looked better, automatically they look better. So how can we take care of the skin, generate collagen production, and slow the aging process down? And also the lasers have gotten better too. And we have more options with lasers, and we have more training. So it's like a combination of like a perfect storm where finally we have resources to make us look better. What do you think is the least amount of like maintenance or laser, like a routine just to maintain? Like what's the basic routine they could do? Like how often do we need to do these lasers?
I think it's smart to have a sort of series of treatments you're doing yearly. If you are young and you're just getting started, that could just be Moxi. And you're doing maybe 3 to 6 treatments 1 year. And then maybe next year you're only needing to do 3, but you're maintaining.
So still 3. Okay.
Versus something like,
so let's say you're step starting. It up. You guys need to get on the books.
They're like facials.
3 times. I need to do it. I don't even do it for myself. I'm too tired.
I wish I could get treated more than I have. I think at this point I'm only getting treated twice a year.
You and I, like nurses, need to take care of ourselves.
Providers are probably the worst.
We're hard. Everyone thinks that because we're in aesthetics, we get so much done. But like,
nope.
After a 10-hour day of hearing everyone's wrinkle complaint, I just want to crawl in bed and drink some wine. I'm like,
exactly.
I'm going to slap on some products in my face. Okay. What do you think about red light therapy? Do you think it's totally BS, or do you think the lights are worth it because you're all in the laser world?
You know what? I don't know. I can't vouch for at-home treatments. I know. Although I've been very, very
now I'm curious
about them.
Yeah.
Because I know how powerful red light can be as far as being anti-inflammatory.
Right.
And we've seen, at least at Saiton, how much red light is able to give patients sort of like it's great at sort of helping the skin retain hyaluronic acid.
Okay.
Yeah,
that's
and
helpful.
have this hydrated look to the skin.
Okay.
And it's very gentle. Red light is the most easily absorbed by the skin.
Oh, okay.
For most skin types.
I didn't know that.
So I feel like, and it's also really easy on the eyes.
Okay, so if I stared into that thing, forgot to wear the goggles, I'd be okay. So I did.
Let's not say that.
I can still see fine, but it was like,
Well, if you think about it, a lot of those like camping lights are red light, right?
Oh, yeah.
Yeah, because it's like, it's a lot easier on the eyes versus flashing like a white light or a yellow light at someone.
All right.
But so I'm hopeful that we're developing at-home treatments that could work similarly.
But there's no science on the at-home ones, really, like clinical trials, right?
The only like at-home devices I know that actually have clinical trials are like, have you tried Medicube? Okay, so Medicube is like, and the thing
I've heard of this.
At home you can only use so many different energies. So it's either LED light,
okay,
which I think Medicube has some devices like that, or microcurrent.
Yeah. I
Yeah.
have the microcurrent one.
Yeah, there's always like some form of microcurrent.
Okay.
And I think that's one of the only companies in their Korean company that actually have studies that
Really?
you can,
Medicube. Okay. I think
Yeah.
I have heard this before.
Yeah.
It's ringing a bell back there.
Yeah. But I hope that this becomes the trend and there are more and more.
Yeah. We just don't want people burning their faces off at home.
Exactly. Or their eyes like
Yeah.
going blind.
Yeah. Be careful.
Yeah.
So 3 lasers a year minimum.
Mm-hmm.
All right, you guys, get on the books. Where would Morpheus go in there? Because I have Morpheus. Would I do 1 a year to maintain?
1 a year. Or
That's what I've been doing every 6 months.
yeah. So to me, it's like either you do a series of smaller, more gentle treatments like Moxi,
more
or you
intense.
do one big intense one every year. And it kind of depends on how much downtime you're willing to have.
Yep.
Right? Like how much downtime can you afford?
Mm-hmm.
And then also what your goals are. So if it is more pigmentation, that's definitely going to be Moxi. If it's more laxity, that'll be more Morpheus, right? Yeah.
I really felt like Halo gave me the tightest look though.
I love
Halo was like the best.
Yeah.
Because it goes deep and how would you compare that to the tightening of Morpheus? Like they're totally different though, because they're contracting different depths in the skin.
Yes. And I'm going to say if there's a place for both, I would say Morpheus is probably better body treatment as far as managing, because you do want to be deeper.
Yeah, you do.
Whereas, on the face, I feel like a halo is actually
because that's where the collagen is. Yeah.
And because of the fact that now we're not just using radio frequency, we're using a laser that's continuing to target, pigmented lesions, red lesions at the same time. So you're getting more with a halo on the face then
it just has so much downtime.
That's the only thing. Yeah.
I know.
How much downtime is there with the Morpheus? I haven't actually had
not much. That's the thing that's magical about
That's
it.
what I know about RF microneedling.
I know. It's like hell during it, and then when you're done, you're just like, yay.
Yeah. It's really forgiving downtime.
And it's like you're burning calories because you're sweating. So it's like you're also increasing your whole body's metabolism. So yeah, I mean, it's good to kind of understand all these different, there's going to be so many treatments in the same just with injectables. There's so many injectables going on right now that education, we really have to be educated. And it's if you want to be in aesthetics, you kind of have to keep your education up and really attend a lot of seminars.
Yeah.
Or just offer the bare minimum and be really good at the bare minimum.
Yeah. I mean, that's very, very true. And you were asking earlier why lasers are such a big deal now too. And the thing is, it's technology just gets better and better and better. And I think it's just easier and easier for us to now have these amazing devices.
Yeah.
And I think the same thing goes with injectables too. We're just discovering all of these new ways to make better products.
So we're officially in the aesthetics boom.
Yeah.
It's booming. It's going a little bit crazy.
Yes.
I like to kind of keep my connections because everybody has their own specialty.
Mm-hmm.
And you always want to know who to text if you need help.
That's true. You need to have friends in the industry. It could be very easy to get catty and it's easy
I always think for the new nurses, this is probably the hardest industry to get into right now, just because when I started and you started in aesthetics, it was really a slow curve and we didn't have that many products and we didn't even have that many lasers. We had the basics, but now there's exponential products, the expectations from patients to know everything, and the pressure to know every injection site on the face and perform is really stressful for new injectors.
Oh, yeah.
But there's also a million training programs that some of them are good and some of them are not as great.
Yeah. And I think it's because we're just now coming into a time where there are even trainings that you can, when you first started,
we didn't have training.
We had to wing it.
Yeah.
So when people ask me, what classes did you take when you got into the industry? Classes? I had Mishell. That's about all.
I would cry in the bathroom and then I'd have one training and I had to freaking do it and pray.
Yeah.
And I learned the hard way, but
by
now
winning it, making mistakes.
You have
learning.
to.
Yeah.
But now some of the nurses are I don't want to make a mistake. I mean, you have to kind of put yourself out there to learn. There's a learning curve to everything, unfortunately. Yeah. And you have to go through the process. But now the benefit is there's more education out there. And I almost think there's too much education where people are conflicting.
It's very saturated.
Yeah, it's saturated now. So it's creating another problem where people are fighting online about what makes sense. But, that's just a state of where we're at. It's an exciting time, but it's also very confusing for the patient out there trying to navigate what to do.
Very overwhelming. And it's interesting too, because now patients have a lot of access because of social media. They can access all of this information as well, which just adds to the mix.
Yeah. And I always tell, the hard thing too is everybody has an agenda, and I hate to say it, like, I work for certain companies, you work for certain companies, but also we have different experiences. Like, you have a heavy laser background, I have a heavy injectable background. So it's kind of like, it's hard for the patients to navigate, because everybody has a different, there's no like rule book for aesthetics. It's kind of like art and science. And we're all like little mad scientists and artists that like have a different specialty within aesthetics.
Right? Kind of choose your poison, I guess.
Yeah. So I guess, do your research as best as you can out there. But if you can find products that have a lot of clinical trials behind them, that's probably the best. Maybe go for injectors online who are educating you and not just dancing. I do both. And
which one do you do better?
I don't know.
The dancing?
I don't know.
Just kidding.
But if they're trying to educate, that's a plus in my book.
Yep.
If they just have a selfie with their tits hanging out, maybe just make sure they have some education too.
Yeah.
So
I agree. And the education part of it is kind of rough too, because what I'm learning is there's a lot of opinions in the industry now. It's like
very opinionated.
So as a patient, it's really important to, when you're doing your research, identify where the motive might be coming from too with some providers, right?
That's true.
Yeah.
It's so hard like to decipher through everything. And I still don't understand why some of the surgeons have massive problems with injectables. Like, a lot of the surgeons that have med spas are very like pro injectable because they're making money from the med spa.
Yeah.
But like, you also, it's just, I don't understand the motive. It's like, is that just getting you business? Just hating on aesthetics?
Yeah, actually, I meant to ask that because I have no background with Sculptra.
Yeah.
But I hear that a lot of plastic surgeons will
was a
usually
big
turn
thing.
Patients away.
I don't think they'll turn people away. It was a big topic a year ago. Exactly a year ago, it was blowing up online, and there was so much discussion. And I think, some of the big leaders within the industry for Sculptra and that are trainers basically said, and we've had multiple conversations with some plastic surgeons as well, with the trainers, that like, as long as Sculptra is placed in the right level in the face, which is dermis, subcu, or super periosteal, then it shouldn't be a problem. But if it's like right smack in the muscle or the SMAS, then that can cause more problems. So really, it's an educational technique thing. Yes.
It just comes back to that every time. Make sure your provider is educated.
Yeah, make sure they're doing, and that's why, I train on Sculptra, and I started my own private training company called Syringe Science on mainly Sculptra because it's such a big hit here in the Bay Area, and we need proper training on it. And it's really helped my patient load as well as my own face. And I think it's an amazing product. And so we need to make sure that we're utilizing it properly, just like anything else. But really, anything that creates like density to the skin, whether it's Morpheus threads, Ultherapy, Sculptra, we're all kind of doing the same like fibrotic healing process. It's going to make some facelifts harder no matter what. But, that's just the industry. But the funny thing is that surgeons promoting people, getting a facelift in their early 30s, and then they get a second facelift in their 60s, 70s.
Yep.
That second facelift is going to be way harder than any Sculptra will for you.
Yep.
So you're doing that to yourself. Like, I'm just like, but I've never had any issues with any of the surgeons I've referred to that said we couldn't do a facelift or we couldn't get a good result because of your Sculptra. Like, I've never had that. I think the rule of thumb is wait like a year or two after your Sculptra if you're considering a facelift. So if you come to me and you're seriously considering a facelift, maybe don't do Sculptra, just do your facelift, and then we can maintain it with Sculptra after you're done. But it really has to do with technique And I think just surgeons are having a harder time in general because the expectations are crazy right now online for a surgeon.
Yeah.
And the prices tripled from COVID. It used to be
Yeah.
20 grand in the Bay pre-COVID to get a facelift. Now it's like minimum, I think the lowest is like 40K, but most is like 60 to 80.
I had no idea. That's insane.
Yeah, most facelifts have at least doubled to tripled.
That's crazy.
Yeah. So it's wild. And the reason why is because of social media, because we've had some of these really famous like accounts that are surgeons that have charged a certain price. And now all the surgeons are like, okay, well, I'm just as good as them. Why are my prices not that high?
Yeah.
Which I totally understand. I just think the pressure for the surgeons right now is probably a very hard job, but don't blame us.
But that's why I think there should, if you ask
Don't
me,
blame us.
exactly. I, in
for
fact,
your
think
stress.
there should be a synergistic relationship between plastic surgery and
is.
Yeah.
Most of them have aesthetics that like
when
they have
one
med
grows, the other
spas.
should too.
So we should be connected and really support each other.
Mhm.
And, you know, if it's that big of a problem, do a paper, do a clinical trial on it.
Yeah.
And I think there is a paper being done if I'm remembering. But like, it all goes back down to science, not opinions.
Exactly.
So
thank you. Science, not opinions. That's actually so spot on.
So there's been a lot of discussion on that in the last year, but it died down because we've had a lot of famous surgeons with injectors come on and really talk about the science. And some of the surgeons have even said, you know, I've had people with every single thing in their face and it hasn't been a problem.
Mm-hmm.
It's just like it can be random, you know, from what I've heard. And I did a deep dive on that during that time and I had to do a lot of education. But, you know, good luck because I have a lot of sculpture in my face. Sorry. We'll see what happens. But, you know, there's a lot of hot topics like this, and this is a hot topic, and we all have differing opinions because we all have different, I mean, I'm not a surgeon, so I'm not in there day to day, but it did die down. And I think part of it really does come down to technique.
It does. And,
Yeah.
and I also think maybe what this tells me about some plastic surgeons is you want to make sure you're keeping up to date. You have to improve your technique or
That's true.
pivot depending on what else is changing
That
in
actually
other areas.
is so true.
Yeah. And so if, you know, we know that there's a trend with sculpture right now, or we know there's a trend with certain procedures that are minimally invasive, then it changes the way that you approach as a plastic surgeon. And if you can't do that, then how is that area going to continue to grow?
Yeah.
How is plastic surgery going to continue to grow? Yeah.
See, I like that. They need to pivot too.
Yeah. I mean, that's growth, right?
Yeah.
Yeah. How else does it happen?
Yeah, well said.
Yeah.
So yes, it's confusing out there online. There's always get both sides of this of the story.
Mm-hmm.
The other thing I wanted to go over is that I think is very inspiring that I have Mishell here is she's kind of gone on a different journey as a nurse that's, I think, kind of atypical, but also very creative and inspiring and takes confidence. So tell us your new role and how you're kind of evolving.
Oh, okay. So I knew for years that I didn't want to be a traditional nurse. And I've enjoyed for the past decade being an aesthetic nurse as a provider, a trainer, clinical research. I've worn many hats in this industry.
So you've been a provider, a clinical trainer, and a research
nurse
for
too.
aesthetics.
For aesthetics.
That's amazing.
It's been quite a journey. It's been so much fun and has given me a broader perspective of how product development actually ends up happening in the industry. And so now the role that I'm in with Saiton is a product manager. And so now I get to play a key role in actually improving the product development of these systems like BBL and Moxi and Halo. And that's just really exciting to me because as somebody who, you know, burnout is real in the medical field.
Yeah.
We learned that a few years ago. We don't have to talk about why that was. I think we all know.
I'm like, what am I doing?
Yeah.
I'm sacrificing my life in this.
Yeah. And I think sometimes we think, okay, well, I have this license and I feel like this is what I've dedicated my life to. But I think it's okay for us to admit that sometimes we're interested in
pivot.
trying something different and we want to leave healthcare. to know that that's something that is possible, that there's a path towards that, is what this experience has taught me. And so now I'm going into more of a marketing type of role, using all of the knowledge that I had from being a provider. And that is something that anyone can absolutely do if you have enough passion for yes, exactly.
That is so cool.
Yeah.
It's really inspiring. I mean, because really she used her nursing degree to have like multiple different roles.
Mm-hmm.
And the role that she has is because she took some chances and kind of went off the not normal path of nursing. And they kind of, this role just kind of was made for you because you need someone with all of that past experience.
I exposed myself to research and development, exposed myself to the training cycle.
I like that word.
Yeah. Like I threw myself into different aspects of the industry to better understand it. So I guess to put it very simply, embrace being a nerd.
Yeah, I love that. Hell yeah.
Completely geek out. Find something that you really love, an industry that you really love, and then there's never going to be a cap in how much you could grow. Yeah.
I love that. Yeah. So hopefully that was inspiring for you guys. You inspire me.
Oh, you inspire me.
I'm a little crazy.
Yeah, I love your crazy though.
So yeah, I mean, I've been more of the clinician side. I became a trainer for 2 companies, and then I recently opened my own private training company, which has been kind of a leap for me. I love educating. I love learning. And so that's my passion, is similar to yours, but it is scary. It's scary for a lot of nurses to like envision like something different for themselves and take a leap. Even I think that's really hard. Like we're so like set in stone of like, we have to do something this way. And right now the whole aesthetics world is booming, and there's a lot of opportunities within aesthetics that are different.
And I just have to say too, something that even if we're in a this isn't healthcare in a traditional sense by any means, right? This is completely elective. It's fun, but there's still the being guilty as being one of the main characteristics of a healthcare professional, is that guilt, right? Like you want to make sure that you're always doing the right thing. Yeah. It's wanting to make sure that you're helping the greater good in a way. Right. So it almost feels bad trying to pivot guilty outside of Yeah.
I wish there was more guilt. I feel like people have no conscience anymore. And I'm just like, I feel like no one, I don't know. I'm grateful that you care. Because what I'm seeing out there, I mean, we need more people that care like you.
I think maybe it's the time that we started in where that guilt exists probably, and maybe it doesn't exist quite so much anymore.
So good
for you. Yeah, exactly.
So that's what the point of the story is actually care. Yeah. And like you'll go somewhere.
Give a shit.
No, I think that's true. I feel that guilt too. And I know what you're saying. It used to be like shameful to say that you were in aesthetics because people thought it wasn't you weren't in real medicine. But now the more I'm in aesthetics, the more I'm like, this is hardcore.
It is.
Like I am teaching, I'm injecting, I am writing like adverse event protocols. I'm trialing new products. Like I'm in contact with patients and helping post-care all the time. Like I'm learning new techniques. Like it's actually like pretty intense.
I haven't seen an industry that's built entrepreneurial spirit the same way aesthetics has.
Yeah.
It's taken a bunch of healthcare professionals and turned them into entrepreneurs in a way I've never seen before.
That's true.
That's fascinating.
That's true. I still want a really bad t-shirt line. Like you had me at Botox, you know?
Yeah. Oh, I love that. I would buy it.
I can do your lips. I can't do your life.
Oh. You know? I need that on a hat.
I'm full of ideas. Yeah. I just have to focus.
Aww.
That's how this podcast started, actually.
Yeah,
it was like too many ideas. But also the idea of this podcast is this, I got so many questions in the room that I couldn't answer within 5 minutes that like, I was like, okay, maybe if I have like a series of some experts on or just common questions that it will help the general public.
I love that you're doing this, honestly, because again, a lot of information it can feel like things are gatekept in the industry a lot. And so having this type of conversation or these conversations is really important, especially for those who are starting out.
Yeah. Right? And I'm kind of like a TMI person. I'm like, take my blood, take whatever you need. I'll tell you whatever.
Yeah. Well, we need that. We need that. We need the TMI.
Yeah, well, it was so fun having you on today.
Thank you for having me.
Honestly. This was such a treat. I mean, to really have a true expert in the industry and lasers is like, this is a great resource, and I hope you guys found this valuable. So leave comments, DM, tell us what you want to hear more about. I've been slow on this podcast because life has been really intense. I've been attending a million trainings, started my private training company. So if you need a mentor, if you're looking to get into aesthetics, I can help you. Message me, email me at syringe.science.com@gmail.com. And then if you, Mishell will be around and I can get questions to her if you guys have questions for her for lasers.
Happy to help, honestly.
All right, you guys, take care. Bye. For our latest news, follow us on Instagram at aesthetics.unfiltered.podcast or in our personal pages on Instagram.
Mine is melanie.skin.np and Mishell skin.smarty.np, both on Instagram. Have a great day.